Right, let's go ahead and get started. Thank you guys for all joining us in for an important conversation on childcare in rural and Appalachian Ohio. I'm Troy Hunter, the Director of Research, Evaluation, and Performance at Groundwork Ohio. A few housekeeping items for participation in today's webinar. Today's webinar is being recorded. Closed captioning is available. All participants are muted. Please use the Q&A for questions. We have a full agenda, so if we can't get to your request or question during the event, we will follow up after the event if you provide your email address with the question. All participants will get a recording of the webinar along with materials shared via email after the event has concluded. We bring to you today an impressive lineup today to discuss challenges facing childcare in rural and Appalachian regions of Ohio. We will hear a special address from Representative Jay Edwards from the Ohio House of Representatives, and we'll hear from a panel of professionals and parents with unique perspectives of the impact of childcare disparities in this region. Please follow Groundwork Ohio and our presenters today on social media and visit our website for more information. We would like to express a special thank you to our funders and partners, the W.K. Kellogg Foundation and the Cleveland Foundation. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a committed, nonpartisan public policy, research, and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from prenatal period to age 5. We work hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. This webinar is a product of the Center for Early Learning, whose goal is to transform early learning policy by removing key barriers to accessing quality early learning opportunities for Ohio's youngest children, improving child outcomes, and strengthening relationships between state and local agencies that implement early learning investments. If you would like more information after today's webinar, you can check out our latest fact sheet about expanding childcare in rural and Appalachian Ohio on our website, and that link will be provided in the chat as well. Today, we are joined by Representative Jay Edwards. State Representative Jay Edwards is serving his 4th term as state representative. He represents the 94th Ohio District, which includes all of Athens, Meigs, and Morgan counties and a southwest portion of Washington County. Representative Edwards is the chairman of the House Finance Committee, which is responsible for producing the state's main operating budget and capital budget. He also serves on the House Rules and Reference Committee. Representative Edwards was born and raised in Nelsonville and attended Ohio University on a football scholarship, receiving his degree in mathematics. He's a small business owner, a realtor, and a property investor. Recently, Representative Edwards began working in medical sales with the drug abuse treatment market, and with an understanding about addiction and health insurance, Representative Edwards knows that this is a crucial issue for Ohio's 94th district, and also has a great perspective on how child care disparities in rural and Appalachian Ohio impact Ohio's residents. Speaking of Ohio University, I believe you're there today, Representative Edwards, so thank you for joining us, and we're looking forward to what you have to say.
Absolutely. I feel like I'm back in college again. I'm sitting here at the campus of OU. I see some Athens folks. I see Michelle's on the line. Baker's, or the big ballroom of Baker Center is right there. I'm in Baker right now, and getting ready to join a panel in there. And actually, one of the topics, not as in depth as what we're going to talk here today, for a few minutes, but one of the topics is it's an Impact Ohio event with the Chamber of Commerce, and we're going to be talking about childcare. So I'm talking a lot about childcare this morning and how it affects the state of Ohio, but really rural Ohio. And I've been in the legislature now. I'm in my 7th year. It's crazy how fast time has gone. It's flown by. Such a privilege and an honor to be named the House Finance Chair and get to but get to have my finger on the pulse of an $88 billion budget for the state. I kind of always joke, if you're ever going to be the finance chair, any of you ever want to run for the legislature, be the finance chair, make sure you're the finance chair when the state has a lot of money. It's a lot better when the state has a lot of money. That way you're not looking to cut a bunch of programs and cut a lot of things. But this is an area of interest that I care a ton about. I got to admit, when I got in the legislature, I didn't know a lot about publicly funded childcare, access to high quality childcare. I've met some providers in my area. And kind of began diving in and learning and dealing with JFS and working with some of my local JFS folks that probably many of you know, Jack Freck, a guy from here in Athens County who began to dive in with me. And then, in the middle of my time in the legislature, we had this thing called COVID, and it kind of exacerbated the need for high quality childcare all over the state, but especially here in southeastern Ohio. So it's, I'm very passionate about this issue. I'll just preface the conversation with, I am somebody that believes, and I've tried to get, I'll say, I don't try to talk a lot about Republican, Democrat, but I've tried to get my Republican colleagues to kind of wrap their arms around the fact that, this should be a nonpartisan issue of wrapping our arms around every child in this state should have access to high quality childcare. When we're talking about kids showing up to preschool, kindergarten, first grade, a lot of kids, especially here in southeastern Ohio, have very little structure in their life, have very little education to that point. Who knows about their access to high quality foods? Some of these things that all of you folks are providing, it's too late. We have to get on this earlier. We have to get on it often, and we've got to figure out that this state is a big state. We have different needs all over the state. One of the things I learned coming in 2017 that I found fascinating is I went around and met every representative from all over the state, Republican or Democrat. Regardless of what you see on the news, we get along a lot. We do a lot of bipartisan things. It's not as crazy as it is on the federal level. And one of the commonalities I noticed is there is a lot of similarities between, I'll say, the legislative Black Caucus or the urban areas and rural Appalachia. Single family households, single parent households, low opportunity, kind of falling in the generational poverty cycle, drug abuse, all of these sorts of things that I found it was so similar. However, Appalachia has its own unique challenges that are much different as well. Some of those challenges, I would say the biggest foundational challenge is access to public transit. We just don't have, you might have a family that lives 6 miles out of Township Road, gravel Township Road. You're never going to get a bus to show up to pick this person up and get them from point A to point B. Public transit, I would say, I know it's not a sexy issue. It's not something anyone runs on when they run for office. But I can tell you it's one of the biggest issues that we face in Appalachia. And I would say one of the biggest issues that differentiates us from other parts of the state is getting people from point A to point B. You can put as much money as you want into childcare. You can put as much money as you want into Medicaid. You can put as much money as you want into trying to get access to healthcare, access to childcare. If they don't have a way to get from point A to point B, one of the initiatives I took on when I was a freshman legislator was we have a county, Vinton County, didn't have a grocery store. It was a food desert. We developed a new grant program, got them a Campbell's grocery store. It's still up and operating. If you looked at Vinton County, they were one of the highest counties in the state with diabetes. The only place you could eat there was a gas station or a McDonald's. We're able now, they have fresh vegetables, fresh fruits, and a grocery store there in Vinton County. But still, that's great. It needed to be done. But still, how do we get people from their homes that live 5, 10, 12, 15, 20 miles away from their homes to that grocery store? It is a foundational issue that I'm not sure I have a ton of answers on, but we've got to figure out answers to those problems or we're not going to have solutions. When it comes to the work that you guys do, I will say I think there are some disparities in the rural areas. I think we've seen some providers, not all, fall out of the program because they can't meet the star ratings that are placed upon them. I am not one to want to put an axe to the program. There are some that from the rural areas that have a problem with driving providers out, so they immediately just want to take the axe to the program. I don't want to take an axe to it. I want to dive in and have conversations with you folks on what we can do to try to fix this program so that it works. And maybe that means a different differentiating between the rural areas and the urban areas and the suburban areas. But how do we go about fixing this? And this is more about listening. I know I'm the one talking, but it's more about listening here. And hopefully we'll have some time to open it up for questions, but also beyond this call, I want everyone on this call to know that you can come to me in Columbus, you can come to me in Southeastern Ohio. I would love to sit down and have coffee. And if you have ideas and solutions, one of the biggest problems I've noticed is I think a lot of people out there think that their legislators are experts. They are not. Including me. Some of them might think they are. I'm actually pretty real in that I'm not an expert. I rely heavily. Almost everything I've ever worked on in Columbus has came from conversations that take place, such as these conversations. For you to tell me what works, what doesn't work. We might not always agree, But I can tell you our passion's in the same spot when it comes to access to high quality childcare all over the state, but really in southeastern Ohio. One of the other issues that I think faces groundwork and the objective of what we're after is, as a state, and I've been preaching this for a long time, when the initial bill was passed before I got in the legislature to start this program around publicly funded childcare and got moved over to JFS, they viewed it as an unfunded mandate. They viewed it as that we're requiring the state to reimburse. We're requiring these methods. Some of this is now federal is requiring us based off the block grant that we received. We have to figure out a way to fund childcare in this state that isn't directly or taking up the TANF funds. What that's doing when you're drawing down TANF funds. I'm not saying get away with TANF, get away from TANF funds. It just we need to find other sources. It's not enough, and what that does is it provides competing interest. You have families in need today for money that they're allocating for 5, 6, 7 years down the road. It's really tough when we know we have families struggling right now. So you have some advocates that it's not that they're against your industry, but they'll say, listen, we have needy families that need food right now. We have needy families that need diapers right now. We need that money. It drives them nuts that there's all this money sitting in a pot in Columbus based off of future projections, as opposed to being spent now for the needs now. So we got to come up with new revenue sources. We got to figure out whether it's general revenue funds, obviously, but also if there's any new revenue sources are coming, which, by the way, last Tuesday night, we're going to have some new revenue sources coming into the state. We've got to work extremely hard to figure out how we can get new revenue sources to be dedicated to this thing that is going to move the state so much further along. The return on investment, it's very hard in the age of term limits and legislators that only serve 2-year terms and they can only serve for 8 years at a time. I'm falling into that camp right now to get them to view long-term investments. I guarantee if we set out a goal and accomplish the goal of allowing every child in the state access to high quality childcare and invested the money today, I guarantee 20 years from now, the state would be saving money on that investment because of that big of a difference that we would see of the outcomes. Again, it's very hard to get legislators that are on 8-year limits to view things in 20-year timeframes, but those are some of the issues that we face. The other issues that we face are quite simply, just politics in general. It's very tough. There are people, and I'm not dogging anybody. They get elected by the people that they're representing. But you got people that get to the legislature, and it's everything is based off their political affiliation and how they look at things. When in reality, the people that you're serving and the passions that you have are not Republican and Democrat. We've got to figure out a way to get through that mold and realize that yes, there might be issues with the program as it sits today. We're not saying there. I think everyone on this call would admit that there's issues. How do we navigate those issues that we're not doing away with the program, but fixing some of the issues that persist and growing upon them? So it's something that I'm very passionate about. I think if it reflected on the budget, we put $16 million into some infrastructure programs, $32 million in some other wraparound programs, and now we have a new Department of Children and Youth, which you guys would probably be able to educate me. I've met with the director, Kara Wente. I'm guessing everyone has a relationship with her. I think she's great. I think she's going to serve the purpose really good. Still a little confused of how things correlated with JFS will now move to the Department of Youth Services. We're still trying to figure that out. Whenever you have a new cabinet, there's kind of this weird timing of how that's all going to mold together. But those are things that we've got to figure out. And my question, I guess, if it's okay that I open it up to questions, is I would love to hear feedback on, what are some things you guys have heard. Obviously, the Senate president was a big barrier on childcare in the budget. And I could tell you, I think his motives weren't political per se. I think his motives were really around the problem that we're here discussing today. There were rural providers that were driven out of the market in his area. He didn't like it. His view was, let's axe the entire program and try to get rid of it. Now he is in his last term as Senate president. I'm not saying that's a good thing or a bad thing, but I do think it will enable us to, when you have someone in that powerful position that is able to stall policy the way he's able to, with him not being there, I think it opens up a kind of a new, refreshing course on, okay, let's go back and fix this, as opposed to putting an axe to the entire program. So I would love to open it up to discussions on, what are some things that I need to be aware of? How do we fix this? What are some issues that are, I know kind of the 50,000 foot level of issues of how it affects rural providers in Southeastern Ohio, with public transit, with getting the star rating, with these sorts of issues. What are some other issues out there? How do we go about addressing these issues so that we can fix the program so that it works more for us, just like it does other areas of the state? And you guys are the boots on the ground. I also want to say, because I'm going to have to jump off shortly after questions or comments, I want to thank everybody for what you're doing. It's not easy. We live, we just went through a pandemic. Um, we still haven't addressed, we're still living in what I would say is our lifetime epidemic with the mental health issues associated across the state, especially here in Appalachia with drug abuse and all sorts of other mental health issues that we face. I'm sure you guys are dealing with it back home with every industry that you're in. We've got to do better on addressing that. But again, part of addressing mental health is what you guys are doing every day. And so another reason why I think you guys should be at the forefront of trying to address some of the issues we have here in the state. I've worked on bills with adverse childhood events, some of these sorts of things. Again, getting structure around a kid's life helps tremendously on how we move forward. So with that being said, I do want to sing kudos to one other thing because I'm going back into an Impact Ohio event and sponsored by the Ohio Chamber of Commerce. Groundwork has done an amazing job getting the business community to wrap their arms around childcare. And it's kind of funny during my time, obviously pre-COVID, post-COVID. I can tell you the business community was not talking about childcare 6, 7, 8 years ago. It just wasn't on their topic. It's not that they didn't care about it, but they cared more about other stuff. Now we're getting the business community to talk about it more and enlighten members of the legislature. I think it's so smart. I don't know who built that relationship, but it's so smart and makes the most sense. When we're looking at attracting people to work at Intel and coming here from this state or work at Honda or work at Ohio University or wherever, one of the things they're looking at is how affordable is it for childcare? And what are we doing? What kind of high quality childcare is my kid going to receive in these areas? So I think it makes the most sense for the groundwork and the business community to be partnered. It means a lot to the business community what you guys are doing. It's not just trying to take care of needy kids. It's also part of a business model now. So I do think it's been great planning. We're definitely got more legislators that are more in tune with this now that we brought the business community into the fold. So I think we're on the right path to really moving the ball forward. The questions that we have are, how do we do that so that it's benefiting the entire state and we catch the rural Appalachian, not just Appalachian, Northwest Ohio and the rural parts of the state? How do we get them caught up with a very successful program that's working more in the suburban and urban areas of the state?
Yeah, we don't have a ton of time for questions, and I know you have to jump off, Representative Edwards, soon. I will send you our most recent fact sheet that we just published that has some information around some suggestions, and I'll send you some information. But I do want to open up to our panelists if anybody has a comment or wants to respond to Representative Edwards' question.
You got a quiet group here today. How many people are on the Zoom call?
We for participants, the chat and there's a Q&A question. So I do encourage anyone to drop in questions in the Q&A function on Zoom, but everybody's videos and sound are muted for purpose of the webinar.
Oh, okay, good deal. Well, I do have to jump off, but I just want to say you have my permission to give my cell phone out. My staff is actually from Southeastern Ohio. My staff, Jet Facemeyer, is from, I think he's on the call. He's from Meigs County. Great kid, really smart, really gets back with people, but also very smart. Would love to host some roundtables in Columbus and start talking about this. Now's a great time. I mean, we have a ton of money that we have invested into different programs to move the state forward with priorities all over the state. Now is a great time to start having these conversations. You don't know what 2 years from now will hold or a year from now will hold. Let's start having some of these conversations and figuring out ways that we can get some stuff done to, the governor always talks about planting the seeds that we might not see for a long, long time. Now is a great time with the financial shape of the state that we really need to capitalize on a lot of these opportunities that we have right before us.
Great. We do have a question in the Q&A, Representative Edwards,
Okay.
if you have a minute left to address that, and then we'll let you go. Does that sound good?
Yes.
Yeah, so we have a question from Aaron Newman, and he asked, what other legislators are not term limited and working in this area?
So I'm sure you're probably already heard this name, but I would say the champion on this issue in the state of Ohio right now, and I have the great fortune of working with her. We talk about this issue all the time, is a woman from Dayton named Andrea White. And if you don't know her, you should get to know her. She's very, if you want to work through my office to get to know her, be happy to schedule meetings and sit down. As the finance chair, I have to know a little bit about a lot. She can dive in deep on this topic. She knows about the issues facing Dayton. She knows about the issues facing Columbus, and she knows about the issues facing rural Ohio. She is a champion on this issue. I'm very fortunate. She just got appointed to the finance committee. It was post-budget, but I work with her a ton through the budget. And so she's on the finance committee now. We're actually House Bill 7, I believe, is her bill. And I can tell you, she is extremely passionate. I would say if she's passionate about anything, this is by far her number one issue.
Thank you, Representative Edwards. And Natalie Andrews says that she's a licensing specialist for Athens County, and they're struggling to find new providers, and policy seems to be a big thing keeping them away, along with pay and no benefits. So it sounds like all issues that you covered, Representative Edwards, and are committed to addressing. And we thank you for being here with us today. I'm from Southeastern Ohio myself, so I love to hear the passion that you have for the community and for Ohio's children and families. So thank you for joining us today, Representative Edwards. We will
absolutely, and I'll just tell Natalie, you're from Athens, get a hold of me, send me a message, send my office the message, look me up on social media. I give my cell phone to everybody. Get a hold of me. I frequent the coffee shops on Court Street or OUN or wherever. I'd be more than happy to sit down. I also see Becky asked about the ACES study committee. We are planning on introducing that. I'm not sure if I'm going to be the lead sponsor, but we have talked to people that are planning to reintroduce that. I might be on that again, but that bill is going to be introduced. And we know adverse childhood events are such an important part of the mental health conversation as a whole. But again, thank you guys very much. I've got to run. I really appreciate your time. I appreciate everybody getting on this call, and I look forward to hearing from you. I can tell you, we don't move forward. Part of the job of what you guys do, I know we're asking more of you. Part of the job of what you do, though, it is responsibility, and I hate to give you more responsibility, but part of the responsibility is working with your legislators. We need people, whether it's me or the person after me, we need you to have direct communication because you are the boots on the ground. If we don't hear from you, we have no idea what we're working on. So please, whatever you do, wherever you're from, reach out to your legislators, try to work with them. If you get a poor response, move on to another one nearby, go to the Senate, senators, go to the representatives, talk to everybody, because again, it is so important. Just part of the world that we live in today is having a relationship with the government so they know the issues you're facing. Otherwise, I can tell you, unless they have been in your industry, which many have not, they are not going to know what to be working on. So thank you very much.
Thank you, Representative Edwards. We really appreciate you having you here with us today, and appreciate your passion for Ohio's children and families.
Absolutely. Look forward to future discussions. We'll talk later.
And if you didn't get a chance to ask your question, just please put it in the Q&A and leave your email address or contact information, and we'll circle back and get those questions to Representative Edwards as well. Well, thank you to Representative Edwards. I want to encourage you all again to type any questions or comments into the chat, and we'll have a Q&A session after a panel discussion, and anything that we don't get to, we'll circle back around. And as Representative Edwards discussed, childcare is an important issue in rural and Appalachian Ohio. Children with access to high quality learning experiences within the first 5 years of life are more likely to be kindergarten ready, graduate from high school, have higher earnings, and better health later in life. Despite this understanding, most of Ohio's youngest rural children are not being served in early learning programs. Even before COVID-19, 60% of rural Ohioans lived in a childcare desert. That's an area with more than 50 children under 5 and no providers, or an area with 3 times as many children as licensed childcare seats. Rural Ohioans are twice as likely to experience a childcare desert as compared to 30% of all Ohioans. Ohio's Appalachian region consists of 32 counties, houses over 110,000 children between the ages of birth to 5. And alarmingly, approximately 31,133 of these children live in poverty. What's even more concerning is that 75% of these young children living in poverty do not have access to quality, affordable childcare, despite their economic status making them eligible for publicly funded childcare. And as a result, we see a significant 74% of low-income Appalachian children who are not adequately prepared for kindergarten, setting them on an uneven educational path from the start. So this is an important issue for us to pay attention to. Barriers to overcoming the challenges in this region are unique compared to Ohio's metropolitan areas. Nearly 1 in every 3 Ohio Appalachian children birth to 5 experience poverty, and many of Ohio's parents must choose between taking on full-time work and staying unemployed or underemployed because they can't afford high-quality childcare. Rural families spend 12.2% of their income on childcare. In addition to contributing to economic instability of working families, children in poverty have disparate access to quality early learning experiences. So we have a panel today of professionals and a parent from all across the state that have a great perspective on the issues happening in these areas. First, I'm going to introduce Peg Tazewell. Peg is the executive director at Knox County Head Start, a nonprofit organization providing Head Start and early Head Start center-based childcare, home visiting, and family engagement services. Peg has spent the last 24 years in Knox County developing systems and building community commitment and supporting of high-quality, comprehensive early childhood education services. We're so excited to have Peg here with us today. We also have Michelle Corrigan from COAD for Kids. Originally from Geauga County, Michelle relocated to Athens, Ohio in 2008 to pursue her MA from Ohio University in geography. She served as an AmeriCorps member at Athens County's Children's Services and Live Healthy Appalachia. Before becoming a full-time employee at Live Healthy Appalachia and developing the Live Healthy Kids curriculum with a strong interest in business and workforce development, Michelle then served as the president of the Athens Area Chamber of Commerce and as vice president of Jackie O Breweries before joining COAD as COAD for Kids Division Director in January of 2023. Next, we have Kana Horner. Kana Horner is a dedicated and experienced professional with more than 15 years of service as a Goodwill employee. Starting as a job coach, Kana quickly excelled in her role and advanced to become an employment specialist and later a counselor in special state program. With her passion for helping others, Kana's career continued to progress and she eventually became the workforce development supervisor. In this role, she undertook the challenges of rebuilding the workforce program from scratch and successfully implementing new strategies and programs to support individuals in finding employment. Continuing to showcase her leadership skills, Kana was promoted to missions coordinator at Goodwill. In her role as mission coordinator, she has some exciting insight on a new child care program that they just opened in southeast area of Ohio, and we're excited to hear from her today. Next, we have Erin Finley. Erin Finley was born and raised in Noble County, where she continues to reside with her 2-year-old son. They enjoy spending time with extended family, camping, gardening, and riding bikes together in their free time. Professionally, Erin Finley is a licensed independent social worker and an infant and early childhood mental health coordinator and master trainer for Hopewell Health in southeastern Ohio. She graduated from Ohio University with both her bachelor's and master's degree. Erin provides in southeastern Ohio mental health services and has for 8 years. She's passionate about strengthening rural communities and empowering caregivers and ensuring Ohio's littlest residents have the care that they need. And finally, we have Stephanie Genesso, who's an owner, director, and administrator and lead teacher at R-Nelsonville Family Child Care. She earned her Associates of Arts in Child Development from Mountain State University in 2010, while also earning her Bachelor of Science in Organizational Leadership from Mountain State University. Stephanie regularly participates in countless continuous education credits in the field far above the regulation of 10 hours per year. Stephanie has worked on multiple advocacy coalitions throughout her years that has further advanced not only her educational efforts, but her community outreach. We're excited to have her perspective as a family child care provider with us today. So as we jump into questions, I'm going to direct my first question to you, Michelle, and I would love to hear what your perspective on the unique challenges that rural and Appalachian Ohio faces in providing access to quality child care services, and how do these challenges affect children and families in the region?
Yes, thank you. And, Representative Edwards did a really great job highlighting a lot of these. In rural Appalachian Ohio, especially, we have geographical challenges that affect our region. Most commonly is our population density, in that it's low. And so there's just not as many people living close together in rural Ohio. So this makes it difficult to both find childcare options and for those childcare options to find a childcare workforce. So another challenge affecting this region is that folks often travel a greater distance to work, and then having childcare options available along that route is challenging just because there aren't as many options here. Most folks don't want to travel more than 10 minutes out of their way to access childcare. And so I think it's important that we look at those routes as well when we develop or assist in developing new childcare options. Just going back to the childcare workforce. So Representative Edwards hit on this a bit as well. The definition of quality is contingent on very specific educational degrees. So those can be challenging for us to find in a less populated area. And then furthermore, to exacerbate that, changes to the early childhood education age bands at credentialing universities, such as Ohio University, is likely to create a more narrow field of potential ECE employees in the very near future. So I'm worried that this problem will get worse. So I think it's great that Representative Edwards really opened up his door for all of us to go in and be the experts in this field.
Thank you, Michelle. I'd also love to hear your insights on the impact of poverty on young children living in these areas, especially regarding their access to quality and affordable care.
Yeah, and I think that your one pager does a really great job highlighting this. So many working families in our area are eligible for publicly funded child care. However, they're not able to access it. So the lack of licensed providers who are able to be the supplier of publicly funded childcare, there's just not a lot of them. And we also struggle with providers in our area accepting PFCC. So the subsidies that are available to them, they're just, there's nowhere to really use it. And as Representative Edwards said, I don't think any conversation in our area can be complete without recognizing the lack of transportation that exists here.
Thank you, Michelle. Stephanie, as a family child care provider, I would love to hear your insights on the impact of poverty on young children living in these areas.
Okay, well, one of the things that I noticed is, as she had mentioned, is transportation, trying to get children and families to the locations that are available. There are only 38 locations in Lawrence County. I am wedged between Scioto and Gallia. We have a huge deficit in public transportation at all. Like there are just no options unless you're going to Uber, and who can afford to do that to get to childcare and to work? That's just not an option. One of the other things that we notice is nutrition. Making sure that the children are able to come into a program and know that they're going to be fed, and that maybe the family doesn't have enough groceries for that week. So we are able to kind of be that person that's in the middle. We're their go-to person. We hear that a lot, families that can find childcare. One of the reasons is, I just want to be sure my child is fed today. And that's a sad perspective. The other thing is that we see is mental health in our area because of the drug addiction. So many families are trying to keep it together and work 2 jobs and support a family member that maybe is on drugs. The other thing we see is that their own mental health declines if they have a child who has differing abilities. And so trying to find a child care door that opens for a child with a disability is incredible. There are only 2 in my county, and I am one of those. And so those are just a couple of the things that we are seeing that we really want to find the solutions to.
Thank you, Stephanie. Stephanie, could you share some examples of innovative solutions or community partnerships that have been successful in increasing the investment in early childhood education within the rural communities?
So a couple of the things that we see are, we are proud supporters of Step Up to Quality, and we do see the difference that makes in not just the provider, but the program models that are being built in our communities. I'm very proud to say that nearly every childcare in Ohio, in Lawrence County, Ohio, specifically, is a very highly star-rated program, and that is phenomenal to hear in numbers. We believe that those models help to build good partnerships with our families, providing excellent opportunities for parent education and parent engagement that can help those families meet some of the needs that they are having. Maybe it's on nutrition, how to make a meal, how to just get together with other parents and have a place to vent some of the frustrations they have with their toddlers. So we're proud to be able to do that. The other thing is that our parents are blessed to work with us for advocacy. You know, it's one thing to say we have this problem and this problem in our community, but to join together, send postcards as parents and professionals has really been a great boost to our program. Finally, the one thing that I'd like to mention is Ohio University Extension for their Farm to Table Coalition, helping connect families with local growers in Ohio so that they can provide nutritious meals for their family has been an excellent support to our program.
Hey, thank you, Stephanie. Kina, I would love to hear your perspectives as you guys' new childcare at Goodwill on some examples of innovative solutions and community partnerships as well.
So the solution that we came up with was to be a Goodwill in Ohio, the first one to open a childcare center. After COVID, that was everything that we heard. You know, our workforce staff, they would say, you know, I can't come back to work. I don't have childcare. I've lost my childcare closed, you know, all of those things. And so my CEO and I sit down and said, let's just do this. Let's make it happen. Of course, you know, we partnered with Co-Adit, and I could have never done it without Megan's help. And she's been great, you know, throughout the whole thing. United Way has helped us. JFS has been awesome as well. Some of the things that we are working, some of the partnerships that we're working with is bottoms up from Lancaster, Ohio. They're giving us our diaper program so that we can help the families in need that don't, you know, have the opportunity to buy diapers for their children. We are working with Ohio Can for the individuals that we get that are from foster care, foster homes and stuff. They're working with us on that. And then we're also working with Hunger Alliance for our food program so that we can feed these children. We just received our Star 1. Hopefully we'll be getting our banner soon, and we're going to, you know, aim for those goals of getting to that Star 5 by hopefully the end of next year. But this has been the biggest need for our area. And, you know, the Goodwill that I work for, we serve 8 counties, and Vinton County is one of them that he was talking, you know, Mr. Edwards was talking about. And I agree with him. You know, everybody there's no childcare there. Everybody there has to commute to take their children someplace else. And so my goal is to help with that situation and to open a daycare in the 8 counties that I serve. That will include Pike County and Pickaway County, Vinton County, Hocking County, Athens County, Fayette, and Jackson. And, you know, on top of Ross that we're in. So that is our goal, and that is our next move, and to do whatever it takes to help the workforce, you know, the community to be better and successful, and to help the children there.
That's awesome to hear, Kina. I'm excited to see where you guys get with all those childcares across those counties. Heard a lot of mention from other panelists on mental health and the impact that it has on families and communities. Peg, from a Head Start perspective, you know, for young children, access to quality childcare does play an important role on social emotional development. So how can we better support children's mental health through improved childcare access and quality?
Thanks, Troy, and thank you for taking the time for groundwork to do this today, and for Representative Edwards as well, and for all our partners on this call. You know, when we talk about quality, some of the key elements we're speaking to directly tie to children's social emotional well-being. So structure, routine, warm and welcoming classroom environments, adults who are well-trained, to work with young children who know developmentally where young children should be and don't expect children to be capable of doing things that are beyond their developmental level. You know, one of the greatest challenges we see sometimes is that grown-ups expect children to act like little adults, and they are not little adults. And they really need to be guided by adults who understand their developmental trajectory. And when we can create those quality environments, and that they're environments that are consistent for young children, we can have a really significant impact both on the families we serve and on our community. You know, Head Start has a comprehensive model. So we're not just addressing children's education, we're looking at their health, their mental health, their nutrition, their dental health. And then we're partnering with families and really believing that parents are the first and most important teachers of their children. We know that for our youngest children, it is always going to be the parent who is the most important adult in their life. Or if they have a guardian, that guardian who is consistent, who's the most important adult in their life. And so we want to work with every parent where they are within Head Start. And in addressing children's mental health, we're screening, we use the Devereux Early Childhood Assessment called the DECA in our world. And we're looking at both what the parent sees in the home. So we have parents complete a DECA, and then we have teachers or home educators complete a DECA. And sometimes we see differences. Children act differently with their parents sometimes or in their home than they do in the classroom. And what we're often doing is coaching our educators to have those conversations with parents. So what can parents do to support children's social emotional development? What are we doing in classrooms to support children's social emotional development?
Okay, that's amazing to hear everything that Head Start's already doing. And with that in mind, are there other existing models or programs that incorporate mental health support for children and families within childcare settings? And how can these be expanded and replicated in rural and Appalachian Ohio?
You know, so we are really lucky to have a therapeutic childcare grant from the Ohio Children's Alliance. We partner with the Village Network, and we have 6 centers in Knox County. That enables us to have 2 therapists to provide play therapy directly in our classrooms. Providing therapy in that manner, having it be classroom-based, or in the case of our home-based program, home-based, really opens the door. We see over and over again parents recognizing their need for therapeutic support, and having their child access therapy in our classrooms often opens the door for parents to be willing to access mental health services within the community. So having that direct care really removes a barrier. We are also have partnerships with some local foundations. We have a parent support initiative in our community that provides parenting education through Triple P, which is the Positive Parenting Program. And then we use conscious discipline in our classrooms. So we provide conscious discipline for parents education. That partnership extends to the Ohio Children's Trust Fund, and Nationwide Children's is the provider in our community. When you can bring all of those partnerships together to support the entire early childhood community, foundation support allows us to open educational opportunities to other childcare programs and to all parents in our community. And when you can do that work and really kind of be working together as a community to offer opportunities to all families, you know, we can begin to make a difference. I think something that Representative Edwards said at the start of our call was that we need to wrap every child in the state of Ohio with high quality, with the availability of high quality childcare. And I think that is what is most critically important. Our systems are crumbling. They were crumbling before the pandemic. The pandemic just made it worse. And if we were investing as a state in the various levels of care in a mixed market system, we would begin to see changes in children's readiness, in children's long-term mental health, and in parents' ability to be creative entrepreneurs in workforces because they know their children are cared for in an effective environment.
Thank you, Peg. So we've talked a lot and hearing from different perspectives of providers and people caring for our children. Erin, I would love to hear your perspective as a parent. Could you share your personal journey and experiences in seeking quality child care services for your child in your community, and what challenges did you encounter?
Yes, thank you, Troy. So my kiddo is now 2, but going back to when I was pregnant, I put myself on wait list like immediately, like 6 months into my pregnancy. I was like, we better get on the list for childcare because I knew it was going to be a struggle. But even so, 6 months, I put myself on the list for multiple places. And then when I came back from maternity leave from my or to work, I still did not have any childcare secured through those facilities that I would be on the wait list for. So I had to go with just like an in-home provider. And we did that for about a year. And then I had to take him out due to safety concerns. So we found a new in-home provider because meanwhile, throughout this whole time, I mean, I've called the facilities, checked that my name is still on the wait list. I'm still there if they just don't have a spot for me. So I went with another in-home provider, and this webinar happened at a weird time because we lost care right when I heard about it and was asked to be a part of the webinar. We lost care midday, so I had to leave work and go pick up my kid, and we haven't had care for about a month now. And the county that I live in, we have 1 daycare facility and 1 licensed in-home provider, and that's it. So there are other, private babysitters that, have services in our area, but the hours don't work with my schedule because I work out of county. So I have an hour commute to and from work. And I have placed myself on wait list in the county that I work in too. And I don't have a spot secured. So now my kiddo will be starting, luckily, at the daycare facility. We don't qualify for a child care subsidy. We don't qualify for Head Start, or I would have chose to have my kiddo go to Head Start. And so now we are going to go with this facility mainly because it's our only option. The in-home provider that is licensed in the state didn't have any spots available either. So we're going to do the facility, and that adds about $300 extra to our daycare expense for the month, which, I wasn't expecting because I didn't expect to pull him out. And I think it even makes it more difficult to find care when you've been in a few situations and had to remove your child due to safety concerns, because my priority is always going to be making sure that he is being taken care of in the way that I want him to be taken care of. And I hate even complaining about the cost because I don't think daycare workers make enough, and that is part of the problem. I don't think care is prioritized in Ohio or in the United States in general in the way that it should be. So I think this is a bigger problem, but luckily I work for an agency that's flexible, and, I'm an infant and early childhood mental health therapist. So they get it. They understand, that family comes first and I need to take care of my kiddo. But I'm assuming if I didn't have this position, I would be at risk of losing my job because I don't have childcare, or at least being asked to take time unpaid, which is then another financial concern. So I think there's a lot of difficulties when it comes to finding care in this area.
Thank you, Erin. I'm sorry that you've had that experience. So, thinking about the challenges, what do you envision as being the ideal child care program for your community? And what would that mean for you and other parents who are navigating the same challenges?
So I have 2 answers to this question. One of them is like the ideal picture perfect, if I could make it however I want. And then one is more realistic because I know that our dreams often don't come true. But I have been saying since I started this job doing infant and early childhood mental health, like my dream childcare facility would be in the building that I work in, right? And knowing that the people providing care to my child have the education that they need, have the trainings on mental health and trauma, and have that support. And I do think it would be helpful for, other people that I work with, but there's also different offices in our agency. So it could be just like a whole group effort. I know that that's probably not realistic for every company to have a childcare facility. But I would say realistically, just more options, more state licensed individuals or facilities that are accepting kids at this point, or like, can Head Start just be available to everyone? Can we take that income limit off? I understand the reason behind it, but I'm a single parent in household, and we only have one income, and I now pay more for childcare than I pay to rent my home, than I pay to have my car, right? Like, I pay the most, which I'm not saying it shouldn't be like that, because the care is the most important thing. But when you're in a one income family and have other expenses, I think it just makes it more difficult when you're not eligible for any assistance.
Thank you for sharing that, Erin. I love that in the building I work in. I think that's a strong statement. And what would that look like for everybody? We're running short on time, and I want to make sure that we have enough time for the Q&A. So we're going to skip past our last two panel questions, because it looks like we have a few questions in the Q&A box. Before I read any of those, I did want to acknowledge Representative Isaacson is here with us today. And he just wanted to, I'll just read his response. He doesn't have a question, but just wanted to say thank you to everyone on the call for what you're doing, and that he would love to partner and advance the efforts that we're discussing today. In particular, he was heartened to hear Representative Edwards recognize shared urban and rural challenges, and he's eager to work towards adopting some of the policies in North Carolina, Kentucky, and others that have taken to start making progress on these issues. So he includes his email in the chat box, and I will include it in my follow-up email with everybody, so you'll have access to his information to get in touch with him. So thank you, Representative Isaacson. Peg, we have a question from Robin Coleman. It talks about the information that you're sharing is amazing, and was wondering if she could get you in contact with the director of her center, that she thinks she'd be a great resource. So if you are interested, that's not necessarily a question you have to answer right now, Peg, but if, I can touch base with you after. And Robin, if you email me your email, I can get you in touch with Peg if she's willing. Our next question I see is, and this is open to the entire panel. Do we here see any connection with home-based providers that do not want to be licensed due to the restriction of slots they're allowed to have? Are there discussions on ratio and adjusting those to let providers offer some more slots?
I can try and answer that, in that I haven't heard a lot of talk. I mean, obviously, we know a lot of changes are coming with the new creation of the Department of Children and Youth. I know that they're still figuring out a lot of licensing issues and what they're going to do moving forward. I haven't heard a lot on FCC yet, and I personally haven't heard the number of slots that they allow being the main issue. I more so hear a lot of providers don't want to become licensed because it does require someone to come into your home and evaluate it, and it's your private property. And I mean, that is a cultural thing here in Appalachia as well. So, we do at COED work with anyone who wants to go down that route, and we try and help you avoid any barriers that you might face, and try and make that route to becoming licensed as easy as possible. So do feel free to get in touch. But we are working within all of the licensing requirements that are currently in place.
Thank you, Michelle. Are there any other panelists that want to answer that question? Okay. And then we have an anonymous question that asks, are there discussions on how we can make childcare more affordable for families that right now don't qualify for assistance? Or
Well,
go ahead.
I will say, no, I don't think that there are effective discussions about this, kind of building off what Erin said. We do not value this as a society in the state of Ohio or in the United States of America. And it's really time that we do, that we, going back to what Representative Edwards said, which is we should be surrounding every child with what they need. Like 20 years ago, we were talking about a program in Ohio that went up to 400% of the federal income guidelines. And it kind of staggered the support based on your income. And if we were really serious about caring for young children, we would be doing something like that, but it would require investment from our state and nation.
And just to piggyback on that, because I do see the next question, and yes, licensed homes do have more inspections than centers do, but the last question we didn't get to is how can we advocate for this? And this is for everyone on this call to advocate for these issues. So whether you're an individual or a family or a provider, I think it's important that we all do what Representative Edwards said to do and contact him and be the experts and remind him that we are the experts.
Great, thank you, Michelle. We have another message from Andrea White's office, and just like Rep. Edwards mentioned, their office is doing a lot of work in this space, and they're more than happy to connect. They include Andrea's email, Representative Andrea White's email and number in there as well. That we'll also include in our follow-up email, so you'll have access to that as well. Any other questions? All right, well, thank you to everyone that came today, Representative Edwards, both Representative White and Representative Isaacson for supporting the work that we're doing. Thank you to all of our wonderful panelists sharing their perspective and how we can move the needle on this policy. I think that we're just starting to have these conversations, but if you do want more information, we do have the rural child care fact sheet that's published on our website that'll be included in the follow-up email that we send, and that is in the chat as well. That we also have a blog post in our most recent news stories if you want to read on some other expansions on the issues. And speaking of policy, there is an opportunity to act now. The Biden-Harris administration recently requested $16 billion from Congress in supplemental federal funding to sustain the childcare sector and provide an additional year of childcare stabilization funding. This would include $565 million for Ohio to support 6,260 providers, totaling 401,600 children. So you can email your congressional delegates now and tell them to include supplemental funding for childcare. That will be included in the chat. So we talked, a lot of the conversation today was about we don't invest enough into the system, and 16 billion sounds like a lot, but it's still not enough, but it's somewhere to start. So please reach out and act now and talk to your congressional representatives. Thank you to all the advocates, partners, and policymakers on this webinar today. We are hopeful this conversation gives you some things to think about and some action steps that you can take in your local community. As Groundwork Ohio Center for Early Learning continues the conversation of helping development for young children, we invite you to join us as a partner and ally. For more information on the Groundwork Ohio Center for Early Learning, you can visit our website. And thank you all for joining us, and have a wonderful afternoon.